AM 1430 KRGI 105.5 FM. Good morning. I'm Brian Gallagher, guest on the phone from Central District Health Department. Teresa Anderson, the director, is here to bring us up to date on the latest involving COVID vaccines, especially for the young ones. Teresa, welcome back. Good to have you here.
Thank you, Brian. It's good to be here.
Let's talk about the availability of these vaccines. This is something new because it's for the youngest members of our society, so it's something a little new, and there's some folks that have questions.
Yes, we're pretty excited because the CDC, after the FDA approved, the CDC approved the vaccine. So we're able now to provide both Pfizer and Moderna vaccine to children aged 6 months to 4 years old for the Pfizer and to 5 years and up for the Moderna. So this is a new type of process for us as we're rolling out to I call them the littles. And so what we know is that there are a number of parents who have been very excited and patiently waiting for this vaccine to be available. But we also know that there are parents who have some concerns and some questions, and we certainly understand that. We already give children a number of vaccinations to get them ready for school and to protect them against some of those really infectious diseases. So what we need to do is ask parents to talk to their health care provider or to call us with questions, and we'll gladly answer those questions. We understand those concerns may go on for a while. We understand that some parents may want the wait-and-see kind of approach. Let's see how this rolls out. But one of the things we know is that right now we have a pretty high level of COVID in our community. We're still, for those folks who are going through a testing facility that reports to us, 50% of the people who test are positive. So we know that COVID's still out there. We know that over the summer it's going to go down and things will stabilize a little bit. But we fully expect that in the fall we'll see another surge. So what we're advising, based on CDC recommendations, is we get those littles in, the 6 months to 4 years old, and get them started on their vaccine series. For Pfizer, it's a series of 3 shots. For Moderna, it's a series of 2 shots. But we would like those babies, those little ones, to be protected, and for those kids that are going to preschool and to daycare to be protected by the time the next surge hits. We also have a number of folks who have not sought their booster doses, and we want to have them know we have booster doses available. If you're not certain whether it's time or not, call us and talk to us. Also check our website because we have information there about the second booster as well as the first booster. Some of us who are a little bit older are eligible for a second booster, but anyone who's 5 and older is eligible for a first booster. So we want to keep that in mind going into the fall, especially as we look at going back to school. It's not too soon to think about that, but we're going back to school fairly soon, and we want everyone to be as safe as they can when we hit that fall surge again.
We've been dealing with this for about 2.5 years now. One of the things that we've learned is that change is inevitable. You're going to see surges. We've seen the variants that have come out. We've also seen those who have had great success. We've also seen those who still have those questions, and sometimes by delaying, they make themselves a little more susceptible.
Right, and I think, Brian, the important thing for everyone to remember is that we're not going to eliminate COVID by vaccinating everyone, but what we are going to do is decrease the seriousness of the symptoms and the risk of hospitalization, and especially those who have underlying health conditions, the risk of dying from COVID. So we can get this COVID under control by vaccinating people. We will not totally eliminate it, same as we can't eliminate the flu viruses that come around. But we will be able to control them and make them less than a nuisance in our lives by getting vaccinated. Rather than, if we don't get vaccinated, we're making these major inconveniences and potential health issues for all of us.
Website is cdhd.ne.gov. And
yes.
The phone number they should use if they have questions?
Yes, we encourage you to call us with questions at 308-385-5175 and ask to speak to one of our immunization nurses.
Teresa Anderson from Central District Health Department with the latest on the vaccines, especially for the little ones. Teresa, thanks and stay safe.
Thank you very much. Have a good day.
Good morning from AM 1430 KRGI 105.5 FM. point